Hey everyone, it's Crystal again in the AAFE Training Center, and as you can see, if you watched the previous video, I just had finished filling this beautiful patient's lips. It was her first time, and you can see just how pretty they turned out. During this procedure though, I noticed that I wanted to pick up the downward corners of the mouth or the oral commissures. So I'm going in with the actual dermal filler syringe, making sure I'm tenting up to ensure which plane I'm in, always aspirating, and then putting some filler right into the oral commissures or corners of the mouth there to really help kind of pick it up and support that area there. As you can see, in between each poke, I'm kind of like squeezing the tissue to see kind of where it collapses in on itself or where there's a lack of volume. And that kind of tells me where I want to place the volume or place the filler to kind of support that tissue so it doesn't fold in on itself. As you can see, I'm going perpendicular or against the deficiency as opposed to going straight in and filling in the deficiency. I find this way is a little better in terms of results, and it just kind of offers like almost like a support beam in holding up the corner of the mouth there. And then doing the same thing on this side. So getting as close to the lip as possible without going through the lip and filling in the oral commissures here. I did the same thing and kind of squeezed the tissue to see where I wanted to go, always aspirating and pushing in just a little bit of filler on both sides. This side was a little bit more deficient than the other side, so I think I did end up doing a little bit more over here. So both sides don't have to be treated exactly the same, but you can see again, just kind of going in, squeezing that area and following where I see the tissue is deficient and then putting the filler right in that area. You can see once I've done this and then I kind of squeeze the tissue again, it's way more supported than it was before. I'm just kind of comparing the two sides and seeing that, yes, this side was a little bit more deficient than the other side. So I went in and I'm using the rest of the filler on this side because that's where she needed it. And that was an entire syringe of filler between her lips and her oral commissures. And then I'm just going in and using a little bit of arnica gel on my thumb and kind of going inside the patient's mouth so I can grab the cheek on either side and just really smooth out the filler in that area. You don't want to leave it just like a major lump or bump right there. So I just kind of smooth it out and make sure it feels nice and smooth and symmetrical. And then I'll get her all cleaned up and she will have a final result of not only a lip enhancement, but upturned oral commissures. So thank you so much for watching, everyone, and I will see you in the next video.